Okay, go ahead. So tell me what's working good for you now. That thing you were just starting about.
Well, it evaporated when the conventions evaporated. But before
Um,
that, I just worked a few hours a night on the strip, seeing conventioneers, ingrown toenails, uh, plantar fasciitis, and acute gout flare ups. They come to the desert, they party, they don't hydrate, boom, gout. And
wow.
so I know if the phone rings at 3 a.m., which hotel are you at? I'm going to come inject your toe.
You're kidding me.
No, and it pays well, cash.
Oh, it's all cash.
No insurance. I give them a HIC for 1,500 for them. They're on their own, cash. But anyway, that's gone. So I had no practice because I had no office, no staff, nothing. So luckily, I had about a couple hundred fax numbers from home health agencies that I used to use for my patients. So I faxed them all and said, I'm available. And I've been overwhelmed. In 4 months, I have a full-time practice that I can't take care of. And as the
Wow.
conventions are start coming back, I want to get back into that instead of, I really don't like house calls. But it's been, I'm absolutely grateful that almost overnight I had a full practice again,
And how
doing
do
the
you,
house calls.
do you have a rental space that you have to have, or it's
No,
all?
I have other businesses that I keep my supplies in and my autoclave and uh, bookkeeping stuff. But basically, I'm completely mobile. I don't see patients anywhere except in their homes. I don't go to nursing homes or assisted living facilities, just house calls in their homes.
Yeah.
And so, of course, I have to accept Medicare for most of those. Some are private pay, but
You bill.
I bill Medicare. Yeah.
Okay.
So I've had to get back into that again.
Yeah.
3 or 4 years, no insurance headaches, period. Now that's all gone.
But you think but it's
Our
gonna start
conventions
coming
are
back.
coming back. Yeah. SEMA just announced a big auto aftermarket accessories has a big show, her second biggest. And then the first week of January is Consumer Electronics Show, which is the biggest convention anywhere. And they've committed to coming back to Las Vegas. But we're losing a lot of our small to medium-sized conventions are going to Dallas Fort Worth because they haven't really locked down.
Oh,
Like we still have to have social distancing inside convention space, so they have to basically they'll keep that forever because they want to sell more convention space.
yeah,
You have to
yeah.
have twice or three times the amount of convention space that you previously had just to
Okay.
spread the booths out.
Okay. What an
But so what
interesting.
I'm looking for is uh, I know a lot of retired podiatrists that miss the deductions. They've been self-employed their whole life. They deducted their car, they deducted their home office expense. They got all kinds of deductions as a small business owner. Now, with the retired, they don't have any of those deductions. So I thought maybe, well, everyone wants to come to Las Vegas and retire. We have a lot of retired podiatrists here. They're too old to make house calls, but a lot of younger retirees want to come here. So if they want to work 1 hour a week doing my house calls, 1 day a week, 40 hours a week, whatever they want, I can fill their schedule immediately. And I'm looking that they'll get 80 to 90% of the collected amount because all I need is 10 to 20%, depending on what I have to do for them. If all I do is schedule their appointments, send them a patient, I'm going to collect 10%, do the billing for them. That's even cheaper than most billing services. And it's podiatry specific. So I know exactly what Medicare is going to pay. So I would take 10% of the amount that they collect. If they want me to autoclave their instruments or supply their instruments, you need about 100 nail nippers and 200 nail burrs, autoclave them every night. Then I would probably take 20%, which is still more than, we have two guys in town. One, Stephen Miller, he has a lot of podiatrists working for him doing house calls just like this. Only he's collecting 55 to 60%. They're getting 40%. And then another one that just does nursing homes. Can't think of him. His uncle invented the silicone implants in Phoenix, but he's been
Colorado?
doing nursing. Huh?
Yeah.
I can't
Scarlato?
remember his name.
Okay.
But he's advertised. He's probably seen on Podiatry Management. He's been advertising for nursing home podiatrists to come, and he keeps over 50% too. So these guys, they want to fly in, spend a weekend at the nice hotel, see some shows, and pay for their trip by doing a couple house calls. Basically, they won't be an employee of mine. That will be their practice. I'm just giving them patients for free, charging them for the billing service. And so they can charge initial initial nursing home visit. Initial outpatient visit, $129. And otherwise, if they were an employee of mine, they cannot bill initial visit. They can only bill procedure. So.
And you said people that come to Nevada, they can work under your license if they have a license somewhere else?
A retiree, someone, I have to check the exact details, but something like if they've been in practice 20 years in some other state, there's in good standing in that state, they can come and work in conjunction with me. In other words,
like reciprocity,
I would be responsible for them, but they don't have to test. They don't take the now it's the Part 3 National Podiatry medical exam, which is what is required now.
So it sounds like your challenge that we're talking about, Ernest, is trying to find other podiatrists that you could employ.
Yeah.
What are some?
No, I won't be an employer.
You want to give business to.
I want to give them my practice, but I need to, keep the billing service, basically 10%.
Get a percentage, 10 or 20%. What have you tried so far to get these people?
I haven't done anything. I figure I'll run some ads on Podiatry Management or LinkedIn or something like that, but I haven't really tried anything. And I've considered, and I've reached out to new practitioners, new guys just starting out. But fortunately, in Las Vegas, they're busy from day one, even if they're starting out in private practice. Most of them are employees, which are prohibited from moonlighting or having a side gig. But even the private practice ones, we're so short of podiatrists in Las Vegas right now, and we're growing 20 to 40,000 people a month. They're busy from day one if they're willing to take capitated funds, managed care, if they can get on the programs.
Yeah.
So I've reached out to them, said, I know you're just starting out. This isn't I know you won't like this work, but this will get you some cash flow until your practice is up and running. They said, well, I'm busier now than I can handle. And that's from almost day one. So.
Okay. So you're trying to get
so I think my best bet would be a retiree that just wants to play and then pay for his trip.
Well, but that's going to be a lot of hit or miss doing something like that.
I think it's going to be a tremendous turnover.
Yeah.
But I'm willing to put up with that because.
Well, let's talk. Let's try to explore some other things based on other industries.
Right.
Okay. So this is something I heard recently that happens in the physical therapy realm, and everyone's having a hard time finding employees right now.
Yeah.
Okay. And even my front office staff are being approached. People, hey, and so the way they're approached is, hey, are you happy with where you're at? Are you happy with what you're earning? There's a special email called the 7-word email, and or the 7-word, and basically it says, hey, that's a cute. You're a grandchild.
Oh, that's my boy.
That's your boy.
Yeah. I'm 65, and that's my first baby. 5 months old.
Congratulations! Yeah. Wow.
Yeah,
wow.
I wanted to name him Delayed Gratification, but my wife said, that's what you name a boat, not a baby. And I said, okay, well, we'll name him Skinnerd with Y's, as in Leonard Skinnerd. He can't help but grow up to be a simple man.
But what I was saying is, if everyone else is offering 20%, and you can guarantee that you could offer 50%, it makes much more sense to me. You find who's working for these other people and send them a letter and send it to them and say, hey, are you happy earning 20%? this is a way that you could earn 50% on each patient.
Yeah.
That's the easiest way is to fish in someone else's pond. And I don't know how you're going to get their names. You can probably search it. But
I know several podiatrists that are working for these other podiatrists, but I'm not going to steal their employees.
You're not. You're just giving you're just giving them a better offer.
Yeah, and then someone else will come along and steal them back or offer more, and it becomes a bidding game.
Okay,
So,
but that's one.
I'll consider it. I'll consider it.
That's one way. I know they're doing it within physical therapy,
Yeah.
and basically they're stealing them right from under their nose, because you can offer them more, or you have more, or other better things, like you can work on your own, better training, things like that.
Yeah.
In terms of marketing, you need to get people out there, and it sounds like you're looking for people that are retired or almost retired, because a lot of the younger ones coming out, they're not interested in doing this nail care. Let's think outside the box. Does nail care need to be done by a podiatrist in Nevada?
No.
Okay, so
a nurse practitioner can do it.
Wouldn't it make it a lot easier, Ernest, for you to hire or have them work for you and pay them a percentage, and they work underneath your license like nurse practitioners?
Mm-hmm. Well, nurse practitioners can't have almost a full license in Nevada now.
That's what I'm saying.
They can open up their own office, and they don't have to be co-signed by a physician anymore.
Wouldn't it be easier than finding just a transient?
It would be, but then again, I'm opposed. Like you've seen the rants all the time about podiatrists training nurses for a hospital-based foot care program, and then they fire the podiatrist eventually, and then the nurses take over. I don't want to dilute our profession. Nail care will always be part of podiatry, not full time, but we need to keep our practice in-house. We don't need to dilute it with nurse practitioners or PAs or cosmetologists.
Okay. So yeah. So tell me. So okay. So let's look at these other people. How are they finding these other people that are doing the same thing that you're doing? Are you friends
they're
with them?
advertising and at meetings like the last live present meeting. We have a present meeting and a Northwest Podiatry meeting.
You need to take care of Skinner there. Go ahead.
Yeah. He wants to see the screen. He has about 2 or 3. Hi, baby. The Hamilton hold. Remember that one? It works. He has about 2 or 3 fan club meetings from the Philippines daily, where aunts and nieces and grandma, cute. Like grandma calls and says, Sky, is Sky there? My wife goes, he's sleeping, mother. And she goes, okay, bye. Hangs up on her. She didn't want to talk to her daughter. She wanted to talk to Sky. But yeah, so I see him going around. Here's my card. Do you want to do house calls for me? And they approach me. And that's, at that time I was doing the strip. I said, no, I've got a good gig. But that's how they're getting their podiatrist. And one guy that they hired right there at the dinner table while I was sitting there was in a wheelchair. And I'm thinking, how in the world? I mean, he must have been 80 years old, podiatrist. How in the world is this guy going to go up a second flight of stairs to do a house call?
Yeah, could you team up with that person? Like, is there that much business and kind of learn what they do? Go to the same conferences and trying to find them,
Yeah. Well, you see on the ads that I get all the time from, I'm not sure where it comes from, LinkedIn, I think. There's all kinds of headhunters trying to hire nursing home podiatrists. Some of them are offering $15,000 sign-on bonus. And I don't want to compete with that. And the way that's working is some corporation is doing the podiatrist billing. And then we'll read about it 3 to 5 years down the road that, well, that podiatrist is in prison now, but guess what? That corporation is still going strong. Because they build an E&M code with a falsified bill just to jack up their fees. Yeah. I get patients all the time that show me their explanation of benefits from Medicare where some corporate guy had come through their nursing home or seen a family member in another state. $350 for nail care. Medicare covered it because they had to falsify the billing.
Interesting. So I guess what's your why? Why do you want to do this?
I need Thursday, Friday, and Saturdays. I mean, Friday, Saturday, and Sundays off to babysit this guy. And eventually, I want to get back out of the house call business and back onto the convention strip business.
So you're pretty much.
And I have all these patients that I hate to see go to waste. I mean, although I've only been doing it less than a year, I have hundreds of established patients that I just can't take care of. And I get about 6 to 10 new referrals a day from these
how do you
home health
advertise?
agencies.
How do you?
I don't do anything. All I did was I send out a fax one time, and they started. The phone was ringing off the hook.
You sent it to a home health agency?
Yeah, home saying, well, yeah, we've been looking for a podiatrist, and our podiatrist doesn't answer the phone. They're sheltering in place in Utah, and they don't even answer their phone. They abandoned their practice.
Is the strip better money than doing this?
Yeah,
it is.
Yeah, it's easier work and it's funner work.
Yeah,
but I'm grateful to have this brand new practice full time, almost overnight. But
now, could you just sell this book of business to one of the other podiatrists in town? Like, wouldn't that be an easier option? Like, do you really want to manage people and because that's what you're going to do? Like, imagine the logistical mess of trying to have someone come in for the weekend and schedule patients. They're going to show up, not show up, all that other stuff. Wouldn't it be easier for you just to build it and see if they'll buy it from you?
Yeah, perhaps, but I kind of want to keep my foot in the door, in case.
Well, you send out the way it's going, you just send out another fax and you'll fill up again.
That's true. I don't know how many times I can go back to that same well until they're starting to say, oh, that guy, yeah, he's not reliable.
But what would be how long have you been in Nevada, by the way?
21 years.
And you've been doing the strip
33.
You've been doing the strip for 20 of those?
No. I was doing the strip for about 4 years, 3 years full time before COVID.
And then what were you doing before that?
Private practice or the orthopedic group.
Yeah. Okay.
And my first 3 years here in Nevada, I was working for the ortho group 4 days a week, and I was flying back and working my Kansas practice 3 days a week. So I commuted for 3 years. Wow. I had one of those Southwest Airlines white cards. So anytime I fly, someone can fly with me for free because I had 100 round trips in about 3 months.
Wow. No, I think that it's an interesting dilemma that you have because all of it's home. Is there Health Drive there?
What is that?
I think Health Drive is like they do home visits or nail visits.
No, those are the ones that are offering $10,000 sign-on bonus, and I've seen their ads all the time. But so far, they haven't got a foothold in Nevada because we've been taking care of our own. But that's going to go out. I know these other house call podiatrists are overwhelmed too.
Are they?
Yeah.
Yeah. So it sounds like it's some pent up demand, and you can't find anyone to do it.
Yeah.
Yeah, I think
it's actually a good problem to have, but I like to find a permanent solution.
Yeah, I can see what you're saying. Like you'd like to keep a foot in the door in case you want to go back to it.
Yeah. And not only that, I enjoy the business aspect of it where I'm given superior service that these home health agencies are just blown away with. Like they fax out a referral to other podiatrists and never hear back from them. They never get a progress note. They don't know if they went and saw the patient unless they go ask the patient. When I get a fax from them, I fax them back almost immediately. Thank you for scheduling a house call for so-and-so. Please have them text from their own phone if they want Thursday from 9 to 12 or Friday from 1 to 5. And then I send that same text to the patient. And all of my faxes have a disclaimer on there. Write it, don't say it. Please text so-and-so number, email this address, or fax this phone number, because I don't want phone calls. I don't want voicemail. I want everything where just look at the phone and I know what's going on. Or if I tell a patient, I'm going to see you next Monday between 9 and 12, and then I hang up and I'm driving. What did I tell that guy? Who was that just called? So I look at if they text me, there's no miscommunication.
Yeah,
And
no,
a lot of the elderly won't text, but guess what? They have neighbors, they have family, they have other people that will text for them and, check on them, make sure they're there for their appointments. Which the more help I get for them, the better.
yeah. I'm so now we'll get into high tech, which is kind of my interest area.
Yeah.
What might make sense, certainly you can do an ad in one of those journals or something like that. But really, like, it would be great if you could buy a list of those that are like retired aged podiatrists and send letters to them and just see if there's interest, versus just doing an ad on Podiatry Management or one of these other ones.
Yeah.
But getting an actual list from those around and do a letter sequence or email sequence, or write a booklet about it, or do a webinar or something else, like all these things that I talk about. Like, it would be, and you because you really have to get down what the value message is to someone like my generation. I don't think there's as much interest because we're the surgeon trained, we're not interested in doing it. But I think there is a big portion that, and it's something that's needed. That's where I was thinking, I know you wanted to keep the profession, but if you really wanted to turn into a business endeavor, you would train a nurse practitioner or physician's assistant. I'm sorry to say, but because that's the whole reason, like, they're getting into it, because there's no podiatrist you can find. If you could, so that you have the two options. Okay, you can either find a podiatrist or you can train someone else. If you can't find, if they do not exist, you're not hurting the profession. You know what I'm saying? Like, if they don't exist, like, how can you say you're hurting the profession? Because there's no one that'll do it. What's really being hurt is that number of patients that aren't getting care.
Right.
So I'm just throwing it out there. Like, you can try as you like, put ads in, but if you can't find anyone and there's a really big need, it would make sense that you would hire someone or get someone that would want to do that. And you know what? One thing I like to do is I just test the waters. So what you do is you try to find a nurse practitioner or a PA or whoever, and just say, hey, let's try this for a few months, and just do a test. Because I know it's noble, right? Because I don't want to give up the farm and the office either. But the problem isn't so much podiatrists don't want to do it, that you can't find them.
Yeah. I actually had a nurse practitioner almost 25 years ago in Kansas. And I spent over a year trying to train her. And I would end up always having to come and step in. Oh, well, she did an IND, but she didn't do a PNA. She don't do total contact casts.
No, but you're talking about nail care
and
right now.
she had an X-ray and she missed an osteosarcoma, and that was the end of her.
Yeah. But all they're doing is nail care, you're telling me.
She was in the office, and mostly she was doing nursing homes. We had like 17 nursing homes, and the nurse practitioner mostly did the nursing homes, and it's a couple of days a week in the office.
Yeah, no, the ones that you're looking for right now are mostly home visits, right?
Yeah.
And frankly, if they see something, you have to train them, and they'll send them to you. They'll have you go see them.
Yeah.
I don't know. That's the option I see right now. Because if you can't find people, you're looking to, you have a recruitment problem.
Yeah. Getting back to that list of recently retired podiatrists, what would be your suggestion? Who has these lists?
There's list services. So online,
but they could be that specific for retired podiatrists.
You'd have to. Well, basically, you look at you would get the APMA list, and you would see how many years they've been in practice.
I see.
And so you could see when they started. If you count 30 years forward, you know which of those lists with the APMA list are retired, and you'd send them all letters. And you can
Yeah.
get people to do this. You can get like virtual assistants to do this. I
Mhm.
use something called Fancy Hands,
Uh-huh.
and you could say, hey, I need a list from the APMA, and I want people that have been in practice for over 30 years, and people have these lists,
Uh-huh.
you know.
Yeah.
And then you could send them letters, and you could have someone else write the letter for you. Because if you don't know how to do this stuff, they can write them, they can send them, they can do all that. You could do a monthly newsletter to them until they decide they want to do it. You know, there's a lot of, you have to be creative, but these lists do exist. There's list companies
Uh-huh.
that just have these lists. They're always reaching out to me, want me to buy a list about, you know, but the APMA, certainly you might not buy it from them. You'll probably buy it from a list company though.
Mhm.
So I don't know. Hope I gave you some ideas.
You absolutely did. Thank you. And another question I wanted to ask you is I want to make some personalized Thanksgiving cards. And you know, I've called around and they just have, you know, stock cards. You can add your logo on there or something, but I want a picture and then a Thanksgiving thing. So Fiverr, is that the way to go?
So you can either do it that way. Fiverr is a way you can make cards, and they'll make them and print them. I'm a lazy person. I would actually use something called send out cards.
Uh,
And so send out cards, you add the picture, you write what you want, and you upload your list, and it'll send it to that whole list for you automatically.
mhm.
And you pay a couple bucks a card, but that's how you do it.
Yeah.
It's called, have you heard of send out cards?
Oh yeah.
So that's the one I've used, but I use that frequently. But you could use, so Fiverr, they could design it for you,
Hmm.
but then you'd have to send it out.
Right.
So if you had time to do that, you could, but I would use.
Oh, I can print out mail labels like easy.
Yeah. So you can, so you could use Fiverr. They could design that for you. Or there's
Yeah.
something called Upwork. That's another one, Upwork, that could do it for you. Or just a local printer. They could do it for you too. But yeah, that would be what else?
That's about it. I'm looking to get some virtual assistants. I have a brother-in-law and a sister-in-law that's quite computer
In the
literate.
Philippines, right?
And they're in the Philippines, and you know, I want them to help me with the immediate responses to my faxes, where they can not only text the patient, but they can fax the home health agency back before I see the patient, and then after I see the patient, they can fax the progress note. So
I really like your system that you told me about that texting or faxing. And that's certainly something. I have King, he's my virtual assistant from the Philippines, and they can certainly do that for you. You just set up the protocols. You have to be really clear, and they can get access. If you have like an eFax, you give them the login to your
that's what I
eFax.
have. Yeah.
And you just give them access, and you set up the delineation. They flip their times because everything's, as you know, in the Philippines, it's flipped, but that would save you a lot of time for scheduling it that way. And they could fill your schedule too, depending on what medical record, and they just put it in there for you, your time.
Yeah.
So good.
Okay, Don.
Okay. Hey, nice to chat. Thanks for your questions.
Thank you.
Okay?
I'm gonna keep watching your podcast, so don't burn out.
Okay. I'll keep it up.
Yeah, you're doing good.
Okay.
Thanks a lot.
Have a good day. Thanks.
Bye-bye.